Dan, thanks for coming in today. You seem to be doing very well, very healthy, and of course our goal is to keep you that way. Are there any particular concerns that you have?
Well, yeah, as I was about a month ago, a good friend of mine had a heart attack, and he was a very healthy guy, as we thought. And when I told the story to my wife, she said, you haven't been to a doctor in a while, and you exercise. I really think it's good for you to go in and perhaps get an EKG and a stress test just to make sure you're okay.
Yeah, I see. So basically, you don't want to end up like your friend. Is there anything that we can do to prevent that? Interestingly enough, you mentioned exercise. You are getting some exercise?
Yeah, I go on the treadmill 3 or 4 times a week, and I do about 45 minutes, and I try to do that because I think it's good for me.
It is good for you. That's great. That's actually fantastic. I would encourage you to continue to do that. You don't have any trouble when you do that. You don't develop a tightness or pressure or heaviness or chest pain or anything while you're on the treadmill?
No, I haven't had any of that.
Well, interestingly enough, that's in and of itself kind of a stress test. You're doing half of what we would do in a stress test. The good news is that there are things that you can be doing to try to prevent heart disease. Really, unfortunately, an EKG or a stress test really isn't one of those things in terms of preventing the outcome that your friend had the heart attack. The principal problem with stress tests, most particularly in low-risk people, and right now we have every reason to believe that you're a low-risk person. The problem is that we end up seeing things that don't mean anything. So we're going to see a little squiggle here on your EKG, and you're going to say, well, I must have heart disease, or you're going to say, well, that was a positive stress test, and what are you going to do with that? Well, either you're just going to live with the notion that you've got heart disease when you probably don't. It's probably a false positive. That little squiggle didn't really mean anything. Or more likely than not these days, you're going to end up going to the cath lab and having a cardiac catheterization, a big procedure, and there are risks associated with that. All because there was a little squiggle on an EKG that we did while you were exercising. And we actually have pretty good evidence that doing that is not likely to make you live longer or better or keep you from having that heart attack. But I would like to support you in your efforts to try to do prevention. This is actually a very nice little handout you can take with you today. It talks about stress tests and why they aren't particularly helpful for people who don't have symptoms and the risks that we see with stress tests. But more importantly, we've got a list of things here that you can do something about to prevent heart disease. And good news is you're already doing some of that already. We'll go over those. First of all, there's some things that you can't change. You're male. That's not likely to change. You're 62 years old, and that only gets worse. And so there's not much we can do about that. But what about the other things? Number one risk factor is smoking. I don't know whether your friend smoked. It doesn't matter to me right now, but understand that by not smoking, you've already eliminated the major risk factor for heart disease. That's great. Blood pressure, and we took your blood pressure today, and as it has been in the more distant past, it looks great. So I'd like to say that that's at least probably partly because you're maintaining your weight and you're exercising regularly, and those are all very important things to control your blood pressure. Cholesterol is important. It's one of the major risk factors. We checked your cholesterol, I don't know, 5 or 6 years ago, but I usually recommend that we check about every 5 years just to make sure there isn't something there that needs to be treated. I'm going to ask you to come back fasting. That means 10 to 12 hours without food so that we can draw some blood. We'll check your cholesterol, look at the good and the bad and so forth, and I'll explain all that to you, what that means in terms of your risk. Mm-hmm. And lastly, diabetes is a major risk factor for heart disease, and we can take a look at your blood sugar when you come in for that blood work as well.
I see.
So that would be my plan, is to sort of look at what your risk is and do the important things to minimize your risk and see if we can keep you as healthy as you are today. How does that fit with your thoughts, Dan?
From what you say and basically what I do, that sounds right to me, so I would certainly let's do what you suggested, and we'll go from there.
That sounds great. I'd like to just, as we finish here, emphasize the importance to keep exercising. Don't be afraid, just because your friend had a problem, and And of course, part of that is if you develop any new symptoms while you exercise, call me right away. Okay?
Absolutely.
All right, that sounds good, Dan.
Well, good. I thank you very, very much, and I'll
Absolutely.
see you in a few weeks, I guess.
Sounds good.